We have so many resources in Lancaster County. We have so many resources through the hospital, home health, and EMS, but they don't always line up, and there's gaps and there's barriers, and community paramedicine fills those gaps.
When they call 911, they are asking for help and an ambulance response. This is the nature of the 911 system as we know it now. Oftentimes when we get on scene, the patient does not need necessarily to go to the hospital. They just need guidance sometimes. They need education. And historically, 911 is not prepared to offer that to them, but the Community Paramedic Program will be prepared to help them, guide them to the right resources, assist them with obtaining resources. It adds a whole nother level of the 911 system that we did not have in place before.
That's probably one of the biggest benefits of the program is closing care gaps, meeting people where they are, not expecting them to come to us. Whether they're homebound and they need lab draws, we can go do their lab draws, or they don't have transportation to medical appointments, we can do that. They're running out of food, we can make sure that they have food.
Since the beginning of the program, one of the goals was to reduce, return visits, reduce, ED overcrowding, cut into our call volume a little bit, which is not a bad thing. As we grow the program and we get more people into it, I think, we'll just be able to better serve a larger population with the services that we're providing now.
I feel like the Community Paramedicine Program impacts the community by having that person there that they can rely on and directing them in the correct ways of bettering their health or finding the right resources.
And I think the benefits now are that you have someone who is very diverse and versatile, and that's really in our wheelhouse as far as EMS providers. We have always been the catch-all, jack of all trades, and now we have someone who knows the social services, knows how to interact with medical providers and PCPs, and now we're able to give people those little caveats that maybe went amiss before.
The program helped me with some good advice, and it would save my life. I think that's why the program saved my life.
I think a lot of people fall through the cracks in healthcare, and I think the benefit of our program is that we are able to go out and see these people, and I think that's a big part of it, is we see them, whether it's for medical or food or even clothing. Sometimes we help them with whatever we can, and just they feel seen and they feel better having that, and I think that's really important.